with us as always. With us at our studio, we have Larry Nazimek, who is an Air Force veteran and vice chairman of Coalition Veterans Organization. How are you, sir?
I'm just having a ball, and how are you?
Good, good. Thank you so much for being with us. And we have our old friend, Dr. Mark Weiman, who is an Army veteran and a dentist. And we have had him here a number of times. He's looking great.
Thanks, Cliff.
You said he retired. Did you?
Oh, Cliff, it's tough sometimes, but sometimes you just put the data together and you realize it's the right time.
Okay.
But I'm not retiring from everything.
That's
this
good.
project that Larry and I are working
Great.
on, it means so
That's
much
like
to
people
us.
saying I'm not retiring either, so I know
There
exactly
you
what
go,
you're
Cliff.
talking
I
about.
understand completely.
Yeah, absolutely.
Absolutely.
And you're working with Larry. That's great that you're doing that. And tell us about this. This is a very important thing. Title 38, United States Code to require. This is to amend the code to require the Secretary of Veterans Affairs to furnish dental care in the same manner as any other medical service and for other purposes.
Cliff,
Tell us, that sounds great.
Larry has done such a good job with this bill. We've got 49 Congress people that have signed on to pass it through already.
Great.
And we're just trying to show that we can save money by doing it. We can do what's right for the veterans by doing it. And we can also do a heck of a lot of good for society by doing it. And we look at it as like a crisis, Cliff, and a crisis that we're really committed to solving. And I guess I'm swiping a line when I say great crises sometimes are marked by great moments.
Yeah.
And I think Churchill said that once. I think Secretary of Defense Rumsfeld said it. Well, I just want to say, Cliff, thank you very much for having us on your program. This is really a fun thing for us.
What we do, yeah. Oh, no, this is a great thing. The people like you is the reason we have the program.
Thank
you know
you.
that. Larry, this is just great. Tell us more about it.
Well, there is no question that we should be given the dental care. It was important when we were in uniform. Why is it important now? And every military unit, through the U.S. military throughout the world, they have to make their daily status reports concerning combat readiness. They have to tell how many people have medical appointments with to see a doctor of dentistry, a doctor of medicine, a doctor of podiatry. It doesn't matter because it's all the same. Now that we're out of uniform, the government doesn't seem to think that it's that important. But if you talk to the VA, they're going to say, don't blame us. We're just doing what Congress says we should, and that's what our limits are. If you got a problem with that, you go to Congress. So that's where this H.R. 96 comes in.
That's great. You got a problem like with that, you go to Congress.
Yeah.
So that's what you've done.
Yes.
Yeah.
But when we were on your show previously, we were talking
Yeah.
about, we thought it'd be so easy, but
Right.
there are certain ones that we were really focusing on. And one of them was Mike Boss, the Marine veteran. He's been active in
I remember,
he's
yeah.
done a lot. And we said that we had to go through this staffer, and writing him was like writing to Santa Claus. We were just not getting any reply. Well, I finally got a reply, but here's what it took. Felicia Mitterbrooks of WBBM comes up with her thought for the day, like a nice quote, and she had this one that says,
Wonderful lady.
yeah, so she had this one that says, no response is a response, and it's a powerful one. So I
True.
wrote back and I used that, and
That's true.
and then I says, hey, we're veterans here. We deserve a response. And they responded, well, we're thinking about things like the cost factor and whether or not the VA has the capability and, dance down. But at least I got a response.
That's great.
Yeah.
That's great. So tell us exactly what's in the bill.
The bill just saying that it's going to require the VA to treat dental care like everything else.
Isn't that great?
Yeah.
I think a lot of people, though, would be surprised over the fact that it isn't treated like everything else.
Kind of Larry brought this to my interest a while ago, and he asked if I'd work with the group to show the nuts and bolts why it's justified for dentistry to be treated like all other medical
Sure.
conditions.
Yeah.
And in many ways, I like to think of myself as a hired gun for the veterans group. And if technical
love it.
problems, I love it too,
I love
Cliff.
it.
I love it, Cliff, and I'm honored to assume this position. If technical problems come up by denying veterans dental care, I like to really show the public the nuts and bolts of the problem. One problem that we're dealing with today, I just looked at the Tribune this morning before I came over here, is the opioid epidemic.
Okay. Sure.
Now, I know from 40 years practicing dentistry that if I delay treatment for whatever reason, and then I eventually am put in a position where I have to cure the patient and get him out of trouble, it is much more difficult to get the patient out of trouble if we've delayed treatment until it becomes very, very, very significant. If I could deal with it in an incipient stage, I could have a much greater chance of getting the patient out of trouble without having to give the patient opioids. And I've been reading a lot of data that's been accumulated about the opioids. 6 to 8% of the people that are experiencing opioid addiction problems are first introduced to the opioids through dental care.
Wow.
That's too hard.
Yeah.
It's hard on the person that's addicted.
Yeah.
But as we saw in the Tribune this morning, on the very first page, the very first article, it's about this little boy, 5 years old, whose parents beat him up and literally killed him.
Oh, yes, I know.
And then they buried him.
Right.
And then I read through the article, and it said, and it basically quoted a previous husband of the young lady who had the child. She was a delightful woman until she became addicted to opioids.
Wow.
For many people, it is very, very difficult to break the addiction problem.
Now, is that primarily, what do you take that for? For pain, is that it? Or
If the pain is very, very significant,
yeah,
a lot of dentists, a lot of healthcare professionals will give opioids to get the
that
patients
right?
out of trouble.
Okay.
On a previous show, you were nice enough to have Dr. Larry Zager, an oral surgeon.
Yes, right.
All of us are recognizing,
Right.
Cliff, this tremendous problem of opioid abuse. And Larry has been doing research,
Right.
and in many cases he's been trying, as opposed to giving the patient opioids, he gives various combinations of ibuprofen and acetaminophen, and he's been getting very good results. Now, I've got to put a caveat in. Larry has very, very good hands, so when he does these dissection procedures, he's very gentle in treating the patient. A lot of them probably don't have really significant pain issues. But he's just so talented, and if he can come up with various techniques to dodge the opioid abuse problem, I'm in.
That's great. Doctor, what, Nazimek, tell us how you've got a number of members of Congress, you said, they are behind H.R. 96.
Yeah, we have 49 among the Democrats, and we're still trying to get our first Republican. I have no
Really?
Yeah, why should this be a partisan issue? I don't know.
That makes no sense at all.
But I will say that for the state of Illinois, we got 10, which is more than any other
that's
state.
great.
More than any other state.
That's because of you, right?
I don't take credit for all. I'm just one of many. But I would like that all your listeners, to see if your congressman's on the list. Well, the ones in Chicago proper are. But like there's Lauren Underwood. She hasn't signed it. She replaced the.
And she's new.
Yeah, I know. She's on the Veterans Affairs Committee.
Yes,
Okay.
and she hasn't signed?
Nope. And she replaced the guy, we had two Republicans before who
Right.
were co-sponsors.
Right.
And Randy Hultgren, she replaced Hultgren. Well, Hultgren was one of the first to sign on as a co-sponsor, and I know he was interviewed on WFLD about the issue. And we didn't even have to approach him. We just saw that it was a good thing, and he signed on.
I'm glad to see, I'm looking at the list that was just given me, that some of the congressmen who have signed on, as was just mentioned, a number of them from Illinois. Mike Quigley is on, and so is Dan Lipinski, so is Danny K. Davis, and we're pleased to have him. Bobby Rush is also a signatory. All of those are from Illinois, of course, and that's a good thing. Because anybody who knows having problems with your teeth can really do a job on you.
There's no question.
I mean, there's so many other problems that, that it brings about, right?
Cliff, I could keep you going by showing the correlations between orthopedic surgery complications and dental issues, cardiac complications and dental issues, diabetic complications and dental issues, pregnancy complications and dental issues. We could just go on and on and on. But right now the opioid issue
really
seems it's really on the first page. But can I just correct something?
Sure.
Larry doesn't take credit for the good job that we're presently doing in Illinois, and I have to take exception to that. I have never seen a gentleman work harder for an issue than this gentleman has. Thank you, Larry.
That's great. No, and I thank you too, and so do all of us. It's just horrific that the Secretary of Veteran Affairs, you would think if a veteran comes in, you'd get the service that you need. I mean, they don't care. Why not?
It doesn't seem logical, Cliff.
No.
We're working on it.
Oh yeah, I'm so happy you are.
I'm sure if we present the right data to him, he will be amenable to the change. We have various things in the future on our agenda. We're looking at trying to get more covered in the VA system, but also we're looking, Cliff, and a lot of this has to do with the producer of the program, Glenda Smith. We were getting ready to conduct a meeting, and Glenda called me right before the start of the meeting, and I was scheduled to give a lecture on the correlations between so many different medical problems and dental care. And Glenda said something to the effect, move forward quicker. This is a very important issue. We've got to take decisive action. We've got to step up and help out the veterans. About the same time, Larry and I became aware that somebody that we knew very well had just passed away. And I was asked to write part of the obituary. And this had been a classmate of mine in dental school. All right, so my part of the obituary is the dental school environment where this gentleman and I spent time. One of the other fellows in our veteran group had spent time on the ground in the jungle in Vietnam with him. He spent time discussing what Dave did on the ground in the jungle. And can I just tell you a quick thing, what happened to him? Dave was an infantry company commander.
Okay.
And they started to take fire in an ambush. And he moved forward into the face of the fire, which is what you're trained to do in the infantry. And one of the men threw a grenade at the source of the fire. And the grenade hit a tree, bounced back into the own position, and it landed in Dave's lap.
Oof.
The fellow had forgotten to pull the pin.
Thank goodness.
So Dave,
Wow.
I swear, he saw his whole life flash in front of him. I don't think he's ever been quite the same since that time. And then they were going to give him some time in the rear after this incident and after the firefight. And for whatever reason, Dave couldn't make the flight on the chopper back to the home base. And the chopper was shot down by the Viet Cong, and everybody on the chopper was killed. Well, Dave passed on from a disease called mantle cell lymphoma, which has been correlated to Agent Orange exposure.
Okay.
All right, so my job was to write about my experience with Dave in dental school. And I did research to include so many of the people that I'd known in the dental school. So many of the people in the dental school were veterans, and so many of the professors had instructed at Walter Reed or treated patients at Walter Reed. The dental school was a, quote, military-friendly environment. And I listened to your previous segments. When a lot of us came home from various tours of duty around the world, not all environments in the States were military-friendly.
That's true.
The dental school
This was one of them.
I'm absolutely, and I'm putting it in front of Larry, and I'm putting it in front of some of the other gentlemen that are in our veterans group. We decided, let's maybe reach out to the dental schools to provide care for the veterans. That'll save us the tremendous amount of money setting up new clinics in the VA system, hiring new professors to take care of the tremendous number of veterans that need treatment. And this goes back to Glenda. She's the one that put that idea on our mind at the right time.
Well, that's great.
And we're moving forward.
That's
Cliff.
wonderful.
We're moving forward.
That is wonderful. So how long have we been working on this?
Well, the real
Larry,
tough part
thanks.
was when we went from the 115th to the 116th Congress. We had to get somebody to introduce 96 because 4556, the predecessor bill, was introduced by Congresswoman Carol Shea Porter of New Hampshire, but she was retired.
Okay.
So getting somebody else to reintroduce it was the tough part. And we wanted to get it done early. We were told that it helped if it would get a lower number.
You know, Doc, when you say it was difficult to get somebody to introduce it, it's almost unbelievable to me that first, it ought to be there anyway. You know what I mean? I mean, it ought to be treated as any other problem that that the VA does. But I would think that there'd be bipartisan involvement, and that everybody should be in line there. Let me sign. So
It's shocking.
it is shocking. It is shocking. So
We haven't done our job well enough. Larry and I will not give up till this gets accomplished.
I believe that.
And
yeah.
it's the right thing to do, not only for the veteran, but for the whole society, for the country. We'll get it done. The movie Animal House, knowledge is good. I think Larry and I maybe haven't quite done as much as we're going to do. We're going to get the knowledge out to the regular community, and we'll get it done.
But we could really use if your listeners would, make the call to try to get some more co-sponsors. Go for Lauren Underwood, Sean Caston, and Foster. Out to the west.
Okay. Mention those.
Well, I'm just saying for
No, that's a good thing. Yeah.
Chicago area, because you're
Yeah.
from Chicago area.
Right.
So it'll be Underwood, Caston, and Foster.
Okay.
Those are three from Chicago that we don't have. And if you want to go further out, then we get into the Republican areas. La Hood and Kinzinger.
Okay.
Kinzinger's, Air Force.
Yeah.
And I did get a response from his office, and they were just saying, well,
He's a veteran.
Yeah. And he's saying, well, he hasn't taken a position on it, and he's not on the committee. Like, as if you're not on the committee, that who cares? It's not. It's
Which
not
is crazy.
Yeah, crazy.
Yeah. Okay. This is really a situation which I'm sure glad to see the two of you working on this. Our number is 312-374-8130. This is America's Heroes Group. I'm Cliff Kelly, and we are so pleased to have these two wonderful gentlemen in the studio that working on H.R. House Resolution 96 to amend Title 38 United States Code to require the Secretary of Veteran Affairs to furnish dental care in the same manner as any other medical service and for other purposes. And to both of you, Larry Nazimek, Air Force veteran, Vice Chairman of Coalition Veterans Organization, and of course our good friend Dr. Mark Weiman, who is back with us, American veteran and Army veteran, rather, and a dentist. If somebody asked me the question, gentlemen, does the VA treat people with dental problems? You know what my response would be? Yes.
I
would think, I would just presume that that's the case.
I had the opportunity to speak with John Borling just a couple days ago. Are you familiar with General
I know
Borling?
he is, yeah.
He was a POW
Yeah.
in Vietnam. He spent 6 years at the Hanoi Hilton.
Mm-hmm.
One of the rules, if a person is a POW, he's authorized to get dental care in the VA system. There are various other laws that allow veterans, but it's only a small number of veterans that will be treated under the laws. And subsequent to the small number, the facilities are not as extensive as they should be.
That's something.
Yeah.
Let's take a caller. Hi, Tish. Thank you for calling America's
Hello,
Heroes Group.
You're still my governor, but I'm grateful to hear the guests that you have on about this dental issue.
Uh-huh.
I lost a friend who had complications that really started with a veteran. The lack of dental care, it affected his heart and it affected his kidneys. So, but it looks like our government representatives, except for the ones that you named, treat dental care like it's a cosmetic procedure, and they don't give it any importance, and they save a lot of money on it by keeping it, by preventing people from getting the health care that they need. That affects, dental care affects so many other areas of your health. So, again, thank you for having these guests. Thank you for having this program, Governor.
And thank you so much, Tish. We really appreciate your call, and you're right on point. Thank you so much. She's totally correct.
No question. Many years ago, we used to think, well, your cholesterol numbers were really a predictor of potential heart problems. Your weight was a potential predictor. Your blood pressure was a potential predictor. And all of these are important. But a factor that's even more important now is are called C-reactive proteins, which are produced by the body as a sequela of inflammation in your mouth. In other words, if there's a lot of gum problems, or if there's a lot of disease going in and on in the mouth, more of these C-reactive proteins will be produced, which will cause a detrimental effect on your cardiovascular system. And a lot of times they think that's even more important than the cholesterol issue, et cetera.
Wow. And when it comes
Yes,
to the cost factor, people are saying, well, how much is it going to cost to provide this dental care? Well, they're going to save money in the long run because look how much more it costs to treat people for these other things. It's the ounce of prevention versus the pound of cure.
Yeah, but Larry, why would anybody even talk about the cost? That
Yeah.
pisses me off, quite frankly.
They don't talk about the cost of dermatology or podiatry or oncology.
Well, yeah, exactly. And you're talking about veterans, and it just doesn't make any sense to me whatsoever. Well, I want to tell you, you folks are doing a great job, and we have mentioned we're going to make some calls too. We can certainly do that to some of the Congress people, and it's just great what you're doing, and I just want to thank you.
Thanks.